Welcome, everyone. I am Karolina Tóth, and I will be your host this afternoon. We have finally got to the most exciting part of this challenge. As you already know, we had 3 challenges provided by our amazing partners, Gedeon Richter, MSD, and Janssen. In the previous hours, the partners' jury members selected the best idea for their challenge. Beside the challenge winners, we also have 3 other projects who will pitch today. During the jury evaluation, teams could also vote on each other too, using the Junction app. This platform uses a specific algorithm to give points to the projects according to the voter's choice. So, based on these votes, teams with the 3 highest points will also present their solution today. And before we share with you the challenge and community winners, I would like to shortly share with you how the process of the final winner will take place. After the pitches, we will provide you with a link where you can vote on your favorite team or your favorite project. You can do this after the last pitch took place, and you will be able to vote until the closing ceremony at 4:45 p.m. And the team with the most votes will win the main prize of 2,500 euros. So, let's start with the first team, who is no other than the winner of the challenge provided by Gedeon Richter. They created a decentralized data model which could guarantee user trust and data protection. Let's see the Solid Data team.
A huge problem for pharmaceutical companies working with health data is how to access the user's sensitive data without storing it in a cloud, but running algorithms on the data that enhances the user experience. Our solution is a data flow model, which is decentralized and encrypted, but on the other hand, third party has the ability to refine how the app works with a new algorithm that can even perform statistical data analysis while keeping all sensitive data compliant with GDPR regulations. This strengthens the user's confidence in the application. The method uses a federated learning algorithm to achieve decentralization where there are only models on the user's phone. After learning, they are sent to the server in the form of data slices using multi-party computation. We create a new model from the models using aggregation AI, and this is fed back to the users in the form of an update. In this method, the model uses logistic regression, which is taught using a gradient descent learning algorithm, so the user can get more accurate feedback with each update. We have also a project challenge from a medical perspective. We noticed the issue that not only menstruation and ovulational cycle can modify the measured core temperature inside the scabbard, but there are additional influencing factors. After consulting with professional gynecologists and genetists, Dr. László Molnár and Professor Dr. Ferenc Banhidi, we evaluated the problem and raised an idea. During the pre-ring continuous measurement, the Kyndra application will send the user a question form about whether she influences the temperature measurement with additional factors like anti-inflammatory drugs, fever, doing sports, or alcohol consuming. This would help the learning algorithm to continuously learn from real data and could not be influenced with wrong information to mispredict the fertilization window. Measurements, like how a treatment pill influences the temperature, can be stored for additional use. Solid Data is looking forward to help women raise their chance for pregnancy.
Hi, my name is Melinda Segedi, and I want to introduce to you Solid Data. The partners that you can see here under validated our ideas right from the start. Oh, okay. Do you want to pass on the sensitive health data of your application to third parties and at the same time increase the efficiency of your application through learning algorithms? Gedeon Richter is currently working on a fertility window defining tool called PrimaTemp, The device transmits temperature data to the server, where an algorithm tries to determine the size of the fertility window to the user as accurately as possible based on the core temperature. We developed a decentralized data model, which can guarantee users trust data protection. The data model allows Richter algorithms to run algorithms like fertility window specifiers on the user's phone without collecting sensitive health data from there. We're also using learning to specify the duration of the user's fertility window. The method uses the federated learning algorithm to achieve decentralization, where there are only models on the user's phones. After learning, they are sent to the server in the form of data slices using multi-party computation, as we told in our video. The multi-party computation service needs to be installed because we don't want learning models created by Richter to be breached during the storage, so only the data containing the model is put together during the aggregation at the endpoint, but it is stored in pieces. In Richter's get-on server, we created a new model from the models using aggregation AI. This means that the fertility window defining and learning algorithms received from the users are averaged, and then new algorithm is returned to the user's device as part of the software update. In this method, a model uses logistic regression, which is responsible for proper placement of the temperature data called a CCBD between 0 and 1. Between 0 and 1, and sigmoidal curve can be relevant and filtering out those that are irrelevant. Thus, the probability of the relevance of the data can be easily determined. All in all, our method uses federated learning AI that encrypted in using MPC, and the model used logistic regression on devices using a gradient descent learning algorithm. The learning algorithm that is then loaded back to the starting point is capable of continuous improvement and raises the accuracy of the prediction by new data. However, the medical aspect of the question is whether the particular data set is indeed relevant, doesn't it contain external noise or any other influencing factors. To do this, it is important to have very limited, completely voluntary monitoring of the client's lifestyle. We have developed a two-phase noise filtering system that ensures the medical relevance of the data, validating its use for further predictions. The first level of the regression and the gradient descent, which filters out significantly different data with high efficiency. For example, if the device is removed, the value around 30, 35, 36 Celsius degrees changes greatly. For example, when the room temperature is like 18 and between like 30 Celsius degrees, then the data supplies pause, thus avoiding the enumeration of non-vaginal measurements. The second level is much more complicated. The client can influence the measurements results with some actions, so statistically relevant but medically irrelevant data can be provided. Filtering them is also important to increase efficiency. This can happen, for example, with exercise, sexual intercourse, fever, and or taking medications. The former three increase of the value of the CCBT, which can be easily filtered out in the middle of the cycle. However, if this certain situation happens at the same time or the first sterilization window, it directly delimits the fertility window and can falsely prolong the length of the measured ovulation period. To avoid this, we recommend the developers include a feature in the Kinder application that allows the users to regularly notify us if they have performed any kind of activities that listed above, or I mentioned that. The data measured in the period would then be labeled if they differ from the main pattern. The issue of the treatments is even more important as scientists drew attention at the annual Congress's EULAR, other named the European League Against Rheumatism, to the fact that non-steroidal anti-inflammation, antipyretic, and analgesic pills significantly inhibit ovulation even after 10 days of use. It is important to emphasize this in order to improve the efficiency of the users and the model. The relevance of the ID was validated during the communication with Dr. Ferenc Bánhidi from Semmelweis University, Dr. László Molnár from Rózsadon Medical Center, and István Peták from Oncompass Medicine. This you can see the notifications. Thank you for your attention.
Thank you for this presentation. Welcome to the question and answer session. And the first question in the chat is that in one sentence, how could you communicate your solution towards end users?
We're using a multi-party communication encryption, and the model reached users with a software update. No other communication required between the third-party company and the users, because we don't want to get raw data from the users.
There's a question from Mizsák Balázs. Why is it so important to filter data? Could it cause a measurable change in the new model?
Well, yes, it is important to filter data because we want to get the medically relevant and medically irrelevant data to be selected. And it is important that I mentioned in the last part, that there are certain medications that can significantly change the ovulation or the fertilization window if it is used above a certain gram. And so the OpenSSL system protects the data too.
Awesome. And here's an interesting one. Have you created a prototype or demo during this hackathon? And if so, what was the most interesting challenge you had to solve?
It is a good question. Unfortunately, it is a so complex model that we couldn't reach to do a prototype. What we were talking about, so there's a demo that we created, but which we put it on the board and also we put it to the presentation. But it's a model, so to be applied to the real system, it requires much complex work, and that was what we were trying to communicate, and that we were communicated with Rita, that first of all we have the model, which is base, and that's the first part of the demo, and the next step will be that we get the data and actually start the real work.
Right. Why need OpenSSL? Why need encryption if the data only is weight values?
OpenSSL is only an advice of the app developers how to protect the username and the password, but it will be a topic of further discussion.
All right. Thank you for your presentation, and we will go on with the next challenge winner. The next team is with the third highest score by the audience, Vaccination Helper. Their app helps to organize and speed up the COVID vaccination process by providing patients with a way to request a vaccination appointment. Let's watch their video.
Greetings. My name is Ruben Zsidó, and my teammates are Ádám Kékesi and Balázs Prosek. We are the devs with Insomnia. We've made this presentation to demonstrate how our application could speed up the process of COVID vaccination registration. We found the chance and challenge the most interesting and tried to find a solution to connect the patient with the vaccinating doctor digitally. In our app, patients, doctors, and vaccinating doctors can create their own accounts. The patient will be able to choose their family doctor, who will be acting as a middleman between the vaccinating point and the patient. The patient will be able to request vaccination with their consent form filled out using the application. In the future, this filled out consent form could be downloaded and potentially printed. With that information, the family doctor could request a vaccination date from the nearest vaccinating doctor. It will be the vaccinator's task to decide which type of vaccine the patient could get based on their consent form. The vaccinating doctor would be able to choose possible dates of vaccination by checking their list of scheduled vaccinations. In the vaccination center, a patient could just show a QR code on their phone or a printed version, and it could be decided if the patient is accepted for the vaccination or not. Later, a feature where patients can report their symptoms after vaccination to the family doctor could also be added to the app, as well as an automatic EEST fill-out system. Our team still attends a high school in Győr, and we'd be glad if we could continue working on this project in the future. Thank you for the attention.
Hey everyone, could you hear me?
We can hear you. Continue,
Uh,
please.
First of all, our team's name is the Devs of Insomnia, and our team consists of Ruben Zsidó, me, Ádám Kégesi, and Balázs Blasek. We have chosen the Jensen Challenge, which required us to create some ideas on speeding up the vaccination process, the administration. Their problem was that on the vaccinating points, the queue can get really long because it's not scheduled well, and long queues can also cause infections to the people because they're just crowded into a small place. And without digital solutions, managing this whole process of vaccination could cause a lot of paperwork, which is done manually, and that way it can result in errors in the data. Oh wait, I'm not presenting. The other problem is that papers which are carried around the buildings can also contain the coronavirus because it gets tabbed by people who work with it. Thus, digital solutions would be better. In our app, users can register their accounts. Patients can register, doctors and later administrators who will be coordinating the app and allowing doctors and only doctors to register as doctors. So the people who are not doctors can't register the app in the future as doctors. Patients can fill out this consent form which contains their health information and provides the doctors with information on how they can be vaccinated and which type of vaccine they can get in a convenient in-app solution, so they don't need to print that PDF paper and fill it out by hand, but they could also in the future download it filled out from the data entered by them in the app, so they can have it in hand. They can search for their doctor, who is their home doctor, who will be managing their process of vaccination. This doctor will be responsible for transferring the patient to the vaccination center or vaccinating the patient himself. And when the user gets to the patient gets to the vaccination point, he can get identified easily by showing a QR code on their phone, which just basically contains their user ID, and the administrators working there can just scan this QR code and see if this user can go to the vaccination point at that time. Here you can see how our app will solve the problem of selecting a home doctor. There will be a field where they can search for doctors and click on the doctor's name and select it. The home doctors will see the patients who are waiting for vaccination, and they can transfer them to vaccinators who will then vaccinate them at the vaccination point. Of course, the doctor should transfer the patient to the nearest vaccinator. And the vaccinator's job will be to look at his calendar and choose the appropriate date for the vaccination, so there won't be crowds and everything will be organized. Of course, the patient as well as both the doctors can cancel the vaccination.
Thank you for this presentation. Unfortunately, your time is up. So is there a final kind of thought that you would like to share with us?
In the future, the EEST system and vaccination cards could also be filled out, and users could also report their symptoms after the vaccination to the doctors easily.
Thank you for this presentation.
That's all I wanted to share. Thank you for listening to me.
Thank you for your presentation. And we have time for one question. So if the team wants to join in with their cameras, we would love to meet you in person, online. But here is an interesting question. There is a large number of elderly patients who need to be vaccinated, but for many of them, the technical means of getting this vaccine is a little more complicated. How would your solution fix this problem?
Our solution could fix this by having the elderly patient registered by one of his relatives, and that person could manage his vaccination and could print out the elderly people's QR code, and the elderly could just go to the vaccination point and show that paper-based QR code. Of course, he or she will be losing some functionality by not having a phone with him or her at the vaccination point, but the basic functionality will be that.
Available. Thank you very much. Thank you for this presentation. And we have some other questions. I encourage you and also the other teams to answer the remaining questions in the chat by the stage. And with that, we go on to the next pitch of this part of the event. Also, I would like to encourage all the teams presenters to turn their cameras on while they are presenting so we can meet you guys and gals. So for the MSD challenge, 13 solutions came in, but the company chose the following team as the winner. Medicare. They created a telemedicine web application to inform patients about the screening opportunities that are suitable for them. Let's see their video.
Nowadays, many people are trying to lead a healthy lifestyle, and prevention of diseases is essential. However, we are unable to find reliable information. Let's look at Peter, who has focused exclusively on his career for the last 10 years, but his family illnesses have made him wonder how he could prevent these. At Medicare, our mission is to provide the most suitable screening test opportunities for people like Peter. Our goal is to save money, nerves, and life. Our web application offers a user-friendly survey to identify the necessary screening test for Peter. Peter can indicate his health issues through the survey to highlight suitable screening activities. After he accepted his personalized screening suggestions, Peter can register it and search for his general practitioner to send a request asking her opinion about the screening tests. His GP, Helga, gets an email about the request asking to log into her dashboard, where she can choose between their patients. On the personal page, she can accept, remove, or add new screening tests based on their information. She can also sign whether she uploaded the referral to the public health cloud. Peter also gets an email about the updates by Helga asking to log into his dashboard, where he can manage the screening appointments. The system helps to find the designated place of medical service. After that, Peter can update his calendar to get notifications about the upcoming screening activities. To support elderly patients, there's a function to connect younger relatives to their accounts. It will enable notifications about the upcoming events, thus several screening opportunities become available for this group of users. We believe that our web application is beneficial for the whole society. For patients, it offers reliable information and unique digital access for government-funded screening tests. For the general practitioners, it improves efficiency and effectivity of the preventing activities. For the healthcare system, it saves lives and reduces the number of patients who suffer from severe chronic disease, thereby reducing the direct medical expenses.
Thank you very much for the jury to choose our project, and also a big thank you for the organizer for this exciting competition. Now we would like to show our web application, which is now on your screen. We were very motivated to join the Early Healthcare Screening Challenge because we were all personally attached to this topic. Nowadays, many people are trying to lead a healthy lifestyle, and prevention of diseases is essential. However, we are unable to find the reliable information. People are not enough informed about the medical screening methods, so someone's afraid from the hospital, the other one's afraid from the possible bad result, or just don't have enough information about the topic. At the internet, you can find a lot of false medical information. Early screening has a big effect for life expectancy, especially, for example, in breast cancer. Just 6% of women die in this disease if they get an early diagnosis, although if they not screen, this number is nearly 80%. What is your most reliable information channel? We think it is everybody's general practitioner. Your GP knows your medical history, your family medical history, and any other essential...
Sorry, excuse me. We can't see your screen, unfortunately. Oh, now it's working. Thank you. Thank you.
Oh my God. Sorry. So now you see our screen. So your GP knows your medical history and your family medical history too, and any other essential information about you to make a perfect screening test program personally for you. However, they have a lot of other tasks connecting to cure the already known disease. They don't have enough time to take attention their every single patient screening test program. At Medicare, our mission is to help you find the best solution for your screening test. Our goal is to save money, nerves, and life. You can easily use your screening test searcher without sign in. You can write here your parameters like body weight, your age. You can choose from different diseases that you already have. And you can also fill a survey about your habits, like do you smoke or whether do you sports regularly. After that, you can click on the submit button and you will get the screening test program especially for you. Medicare, we recommend you to create an account to contact with your GP with our system.
Nowadays, it's extremely time-consuming to get into any screening test. We try to establish the fastest connection between the doctor and the patient. We design basic authentication system where we protect patients' personal information. The easiest way to do this to link to your email or Facebook account to our web application. Once you are done, you can enter your social security number and then find your GP, with whom you can consult quickly and easily. You request referral online, so you do not have to leave your home for asking medical referral request during this COVID period.
We identified that one of the key issues is the motivation of general practitioners to join the community. There are the main problems that doctors are facing, that they are heavily overwhelmed with administrative tasks, and the personal administration for prevention activities is a time-consuming activity. So that is why we try to build an easy-to-navigate and less administrative application interface to ease their efforts. You can see in our video that we try to design a dashboard where they can use it with only a few clicks, and they can spare a lot of communication and administration via phone or personal, and then improve doctors' effectivity. For the patients, there's another pain point that could discourage them from participating in a screening process. The administration task related to making an appointment in the public healthcare could be exhausting. The problem is that it is hard to find the available healthcare units, and the appointments could be months later, which is hard to remember for. So our solution is to inform the patient. We design special pages that are available, screening programs and forum where they can share their experiences, and we can design them specialized healthcare programs, and to set an appointment, we can make an adjustment for them, find the necessary place to go, and later they can use our calendar to set the appointment and make notifications about it. And thank you for your attention. We are happy to answer all of your questions.
Hi there. Thanks for this presentation. Thank you. Again, we have time for one question, but I encourage you to answer the leftover questions in the chat through Hopin. So in a system where even curing illnesses is a difficult task because of a lack of capacity, how would you insert a prevention program? We are not questioning its importance, but would you also include private practitioners? And if yes, how could you decrease the number of offered options to a level that even a home doctor could see through in a short time?
To answer this question, we interviewed several doctors inside the healthcare system, and they mentioned that there's overcapacity in the screening processes because people don't know anything about this thing, and they need to be informed because they only can be participate if they know about these things. And our solution is one of the top goals to inform our patients with the upcoming opportunities. And later, if our society know more about the screening processes, it could be a good thing to involve the public healthcare also. But in the first step, we are planning to use the free capacity of the healthcare system, the public healthcare system. So.
Thank you very much, and thank you for your presentation.
Thank you very much.
In the last 15 minutes, we could see a solution about telemedicine through a web application, an application about a decentralized data model, and an app that helps to organize and speed up the COVID vaccination process. Now, let's see the other projects. who will also have a chance to take home the €2,500 grand prize. And the second place through the community voting went to a team from Hungary called Screen Me. See beyond yourself, your personal medical screening reminder, which also helps you take care of your family. Let's see what they had to say.
In the 21st century, still 500 women die in Hungary every year in cervical cancer alone. And I could be one of them, but I'm not, because I go screening regularly. I like the 88% of the population based on our study. The key is motivation and information. That's why we bring you Screen Me. Screen Me is a brand new platform delivering your personalized screening schedules, sending you reminders, so you never miss a life-saving appointment again. Based on your age, sex, and on medical data, Screen Me plans your recommended screenings in advance. When the scheduled checkup appears, the platform sends you a notification where you can simply book an appointment in the nearest health facility with just 2 clicks. But we did not stop here. What if you could not only take of yourself, but also family and loved ones? Just easily add your family members to your personal group, and Screen Me will remind you about their upcoming recommended screenings as well. Screen Me integrates with e-health systems, so your medical data is available with minimal manual data entry. After the validation by medical and business experts, we developed the technical prototype, and in addition, we outlined the launch marketing campaign. Here is our team, made up from medical, IT, business, and marketing experts. We are ready to execute. See beyond yourself, Screen Me, your personal medical screening reminder, which also helps you to take care of your loved ones.
Hello, sorry, can you see my screen?
Yes, yes, we can see your presentation.
Oh, perfect. Thank you. So, we are community winners because our message touched people. Our promise has been validated on this community as well. We are not only have a product, but a complex solution. Let me show you what based our solution on. We did a survey involving 286 participants, and we discovered a few shocking facts. 72% knows that there are free screening opportunities available for them, but only 12% go regularly. Moreover, 80% of the cases the GP doesn't draw attention to screenings. So, we provide a platform to bring GPs and patients closer. Based on age, risk factors, and other medical data, our system will schedule recommended screenings for the patient in advance. Before the recommended time frame appears, the app will send you a notification. After, an appointment can be easily booked for the screening in the nearest health facility with just 2 clicks. We also wanted to make the overall healthcare experience better and also help the doctors. So we've designed a system optimizing capacity and to avoid overloading the healthcare system. The algorithm will intelligently recommend the appointments based on healthcare overall free capacity. We also would like to raise awareness of self-examination because we believe that an efficient screening starts at your home. By not only scheduling and reminding about screenings, the system will also remind you to do your self-checks. But we went even further by extending the whole process from individuals to families. Just add your loved ones to your personal group, and Screen Me will remind you about their upcoming recommended screenings as well. This way, you can help them avoid preventable diseases.
Another important aspect of our solution is the education part, which I would like to demonstrate with our developed website. Just a moment. So here you can see our landing page. Even if you just get to this website here, you can get basic but crucial information about screening. In case you are interested in the topic, you can just but the find out more button and find the frequently asked questions. Simple idea, simple solution, but it does not exist in such an understandable form. And we have also an opportunity to log in, so to have your own profile. And just a moment, yes. So we have here Test Thomas. Welcome. In the profile part, you can see the data. This data can be synchronized with your eHub system or added manually. It's totally up to you. And you can see here the upcoming screenings with a short general information. And you can even check your screening history. So it's also very useful. And in the article sections, just to add some more features for the educational part, you can also find detailed articles and infographics written by medical experts about exact screening procedures. As you can see, we've already have a great shell, so we can build on later. And this solution can be this way. Yes. Sorry, this technique. This solution can be out in the market in matter of weeks, but we also wanted to think big and create a scalable, a sustainable solution. So we plan to release the MVP version as a website integrated with the web app. EEST integration, notification, and the painless booking system, which will also integrate with the eHub systems. But in the near future, we would like to include the private sector in the system as well. Native mobile apps and smart device support will also have gather more data. But our long-term vision is also build out government incentives and also support to healthcare decision makings. So here is our team made up from medical, IT, business, and marketing experts, and we are looking forward to your answers, your questions. Sorry, thank you. Yes, here we are.
Hi, thank you for this presentation. And since you have such a diverse team, let's talk about the financial part. How much money would you need to start the project, and on which field would you need it?
So yes, first of all, of course, we need money for the campaign. So and that will help the system to spread and to get users. We can handle the IT development side, but of course we need infrastructure and other really important IT aspects and systems. But overall, I think from around $30,000 or $40,000 we can get the MVP running. We can get the integrations, and like in around 3-4 weeks, probably 1-2 months, we can get MVP out and get going. So that would be the first MVP version. And
Yes, and we are quite lucky because we have so many skills in the team. So the human resource part is solved, and we just have to give money for the other developments and, for example, advertisements, as Balázs told.
Thank you. Thank you very much for your presentation, and I encourage you to answer the remaining questions in the chat as well.
Yes, sure do. Thank you.
Thank you
for the opportunity.
Thank you. And let's move on to our next team. The third challenge giving partner, Janssen Hungary, together with the COVID vaccination center, really kept the competitors on their toes. And the €1,500 prize will go to patient. Their motto is, let's turn the efficiency of vaccination process on. Let's see their video.
COVID-19 has changed our everyday life. People all around the world are fighting the effect of the pandemic. To restart our life, vaccinating a large population is the most effective solution right now. However, the complex and outdated vaccination organizing system can lead us to more waste in time, valuable vaccines, and patience. That empowering healthcare professionals to do the vaccination process effectively and easily understandable by the patient is the key to streamline COVID-19 vaccination process. Service consists of expandable modules. With our solutions, patients will be prepared for and guided along the vaccination process. Healthcare professionals' administrative burden will be reduced in a way that the possibility of data loss or data entry errors are minimized. The development process consists of 3 consecutive phases. First, we launch our MVP with the aim of enhancing patient journey experience by creating one-way communication-based digital solution. MVP is a responsive, informative, user-friendly gamified website. The site allows the user to get relevant information from one source about the overall process. Additionally, it's a personal vaccination journey tracking list. Make available an online field name, printable and portable consent form. A QR code can be generated from it, which later can be implemented into both the hospital and the EEST system. Phase 2, we will be able to connect patient and the vaccination center prior to the vaccination day and even after the vaccination. Third phase, we develop our database service models. We release our MVP in 2 months, phase 2 ends in 6 months, and we introduce phase 3 in 8 months. Our business model consists of 3 stages. We can have a quick impact on healthcare professionals and patients. With your help, within 1 year, we will be able to provide support in the mass vaccination stage by establishing a connection between the hospital and the patient. This way, we contribute to a better capacity utilization of each vaccination point and a faster overall process.
For the first time again. Hey, hello everyone. It's Patient Team here. And first of all, let me thank you for being here, especially after listening to this 2 minutes video that you probably have at least watched once before previously, and after this really exhausting, at least for me, exhausting weekend. On that note, I wouldn't really want to talk about much that I've already said in this 2 minutes video, unless you have actually questions right now, because I know that I can speak quite quickly, and I am so sorry about that. But so many things to say and so little time. But if you do not have any questions right now, I don't know, I do not see the chat, then I would just go on, and please let me just address the elephant in the room. Don't you think that the problem like this, and I'm talking about the Janssen challenge, is so ridiculous that in our times we have to have a solution for? In times when we can buy digital tickets for trains and any vehicles, basically, we can pay via our phone, via NFC, and we can download all our taxing and banking data with just one click. We can't even fill a consent form online. We have to fill it by hand. We have to take it to the hospital. They have to digitalize it, and they have to digitalize it again and again. By this process, we are making so much points where human error can be done. And I don't know about you, but it does really upset me that the fact that once I'm finally there, I get my first vaccine, I want to prove it that I already have gotten it, or I just want to know when my second vaccine will be implemented, or when I will get it. And then all of a sudden someone just tells me, no, you haven't gotten your vaccination, because somewhere, for some ridiculous problem, this data was not recorded in the EEST. Yes, EEST, sorry. So, and just think about it. It's not only the consent form, it's the fact that after you register, your data, your medical records are being transferred through 3 participants via email in an Excel sheet. And even the doctors, even the professionals won't be able to tell whether you're going to have your vaccine just prior the day before by downloading some Excel table from a site. This process is truly unbelievable. And just think about it. It's not only you, it's just your journey. But what about those who are actually working in this environment and they have to go through this journey hundreds and hundreds of times during a day? According to the working professionals who we have consulted, they say that during a day, about 400 or 500 patients will go to the hospital and get vaccinated ideally. This is nowhere near where we should be, because they said that according to the government, for the mass vaccination, we would have to be at 2,500 patients a day, and it's nowhere near there. And it's just really unbelievable. I don't know how they do it. It's really, really remarkable, the work they do. And on that note, I would really like to thank for DPC colleagues who have helped us with their consultations and have provided us with these experiences and these datas. And it really made us be able to understand their problems. And this is what we wanted to give a solution for. That's what we wanted to tackle. We wanted to give a solution that can provide that can ease our journey as well as the workers. So it could be really simple as a QR code. That's what we started with. We need something that can replace this paper. Yes, first step, have something that replaces paper. Second, have a portal where we can access all the information that we need. And after we have been able to gather customers, we have been able to get people on the site, we can build a whole another process that can replace or support the current system. And by that, in time, we will be able to shorten the communication and not having to have a third party between us, but be able to talk directly to the hospital, to the vaccination center that we are going to. And really, that's what I wanted to say. And I just wanted to have a think for thoughts that by the time I was talking, in a way, when you were supposed to go to a hospital, by now, in this time, you were supposed to have gotten your vaccine. Thank you for your attention. And I am happy to answer any questions that you have.
Thank you for this live pitch. And we do have a couple questions. What is the gamification part of your system?
Thank you for this question. It is really great to have it because we didn't really have time to go all the depths. So gamification really starts with the 3 simple steps. You know, when you have a process line, just the simple things, points, levels, and this is the to-do list that we call it, that after you go to the site, and you can actually check it out, OneCode.point, who we have created it. Thanks, Danny, for the site, by the way. We have a to-do list that you can read all your information, and after you've done it, there will be feedback, which is a part of gamification, and feedback that have you done it? Did you do it? And if you did, you can click it that it's done, and then it's going to be green and nice, and then you have this flow, and it will in a later product be able to help you with all the process that you do. So yeah, that's basically the most basic function that we have right now is the to-do list that you can track your way of your flow during your process, and then later on feedback and all these kinds of things will come in.
Thank you very much. And with that, we will move on to the last but not least team.
Thank you.
Let me welcome on stage the first place of the community winning and voting as well. They won the community. Vaxi. Their solution is a user-friendly post-vaccine monitoring application for mobile devices. Let's see their video.
COVID-19 vaccinations are a burden to both normal people and the public healthcare sector. For many people, this is the first time in a while they get a vaccination, and it may be hard to tell what side effects are normal and when to call the doctor. Public healthcare, on the other hand, would like to work as efficiently as possible and only spend time on the serious problems the vaccinations may cause. Thirdly, the pharmaceutical companies would like to receive as much data as possible from the vaccinations so that future vaccinations are safer and can be developed faster. To solve these problems, we've developed Vaxi, a patient monitoring application that is easy to use and acts as a digital assessment of the patient's need for medical guidance. Vaccine needs only the basic information, such as age and sex, from the patient to function to its full potential. It reminds the user to fill a quick daily monitoring questionnaire, which allows for a quick intervention. If the patient's condition is such that medical attention is needed, the patient is advised on how to contact a medical professional. In our application, all data gathered is anonymized but can still be used to form important information about the performance and problems of the different vaccines. This data can be easily forwarded to pharmaceutical researchers and companies through our API to make future vaccinations even safer and efficient. Of course, all data gathered complies with GDPR and is handled with state-of-the-art security. Vaccine, post-vaccine comfort.
Hello. Can you hear me?
Yes, we can hear you
Yes,
and see you.
Great. So hello, my name is Otto Laitinen, and I first I must say thank you to other finalists for great presentations, especially the speech from patient was really inspiring. I really liked that, and also a huge thank you to everyone who liked our solution. It's an honor to get to present to you our solution all the way from Finland. But now for the problems and the solutions. When looking at the second challenge, we identified three stakeholders with problems. Firstly, just normal people. COVID-19 and the different vaccinations have had a lot of publicity, and of course, this causes people to have many different questions about the vaccinations. And for example, while the somewhat memeable microchip mumbo jumbo and other rumors are fun, they aren't really doing good for the vaccine, and it's hard, of course, for people to tell what side effects are normal and what not. Second, the public healthcare sector has been through a lot of stress during the last year, and they would, of course, only want to address those questions and those problems that come from side effects and problems with the vaccinations that are not normal, because of course vaccinations have normal side effects as well. And thirdly, there are the pharmaceutical companies that would like to receive as much data as possible from this vaccination, so that they can develop future vaccinations even safer and more efficient. And to solve this, as you saw from the video, we developed the mobile application Vaccine, and we used in this hackathon, we mostly did work with React Native. But of course, the solution itself wouldn't be possible without all the other technologies here showed here. For example, the PostgreSQL and Amazon AWS really provided us the tools to make a secure solution that is also possible to comply with GDPR. And as said in the video, we only need the basic information, sex, age, to register and start using the application. We really try to concentrate on accessible user interface so that it is clear and easy to use for all ages. We allow for symptom tracking in a free text box format that allows us to use Amazon's word processing to form information from these symptoms. And we also offer a daily questionnaire for the patients or the people that have gotten the vaccination, so that we can actually do a quick intervention if medical attention is required. And of course, the patient is then clearly shown how to contact the medical professionals and how to get care. But of course, we're dealing with medical data, and thus security is priority number one. We use anonymized data to decrease the risks, but at the same time, that allows us to share the data securely for future research. and pharmaceutical companies, so that the vaccinations in the future can be developed faster and are more safer and have fewer side effects. As we are in Europe, GDPR is important. Thus, the PostgreSQL and Amazon and other services we're really grateful for them, because they allow for easy complying of these regulations in our databases. But lastly, to our team, we're a multi-talented team from two of the top universities, students from two of the top universities in Finland, and our multidisciplinarity allows us to carry out even the most complex problems technically, and we also have experience from the medical field already, which allows us for quick implementation in many. But now, what are your questions, please?
Thank you for this great presentation, and we do have a couple questions. You have mentioned that you collect gender and age, but why not collect comorbidities or medication used?
That could also be collected, of course, but we believe that in this starting phase, it is the most important thing is to get the product to the market as fast as possible, and the fewer data we can collect, the fewer regulations we have to abide by. So that is the decision we've made with that.
Thank you, and thank you for sharing your awesome pitch with us.
Thank you.
And with that, we conclude this session. And now that all of our teams have presented, there were some fantastic ideas. We will take a short break, and while we are taking this break, we will share with you a link through which you will be able to vote on your favorite team or your favorite idea. Please click the link in the chat. We will also share it in our Slack announcements channel. And vote for your favorite team. Who do you think was best? Who do you think has the best chance at really putting their product on the market? We will close the voting at 4:45 p.m. and I will see you at 5 p.m. CET.